So let us take some Q&A. So the first question today is by Dr. Manisha Sharma. She asked, so many questions which I am not able to answer, you can write on an email to Dr. Srishti and we'll choose some questions that I will try to answer. Manisha Sharma asked, sir, frequently I face one question by most patients. In the first interview and also in the follow-up, doctor, please tell me, I will get well in how many days? I will get full relief in how many days? How to respond? How to respond? What do you think? I think there is only one way. I think if you tell them that you have to kind of take medicine forever, or if you tell them you have to take medicine for 1 month and 2 months, I don't think it's a good idea personally. So first of all, you have to explain them about homeopathy, and you have to also kind of logistically explain them that different people respond to the medicines in a very different way. And also the fact that many of these illnesses respond very well to homeopathy. I have seen that if you're honest enough and you're able to tell them the possibility of homeopathy, the potential of homeopathy, they are able to understand. Most of them are logical people, and most of them have been to all doctors and then they come to you. So you have to educate them about what is the illness and what homeopathy can possibly do. That is the way out. But don't make some false claims, because the false claim will come untrue and then your name faltu mein will get spoiled. So generally being honest is a better idea in life in general. Life lesson. Let's take another question. This is from Dr. Sonali. She writes, hello sir, I was studying phosphoric acid from previous lecture. You told me to study remedy from different materia medica. Vitulkas writes, Dr. Vitulka is also a beautiful writer. I'm very fond of his writings. He writes, great weakness or enfeeblement begins on emotional plane, progress to physical or mental plane. I didn't get this point. What is the difference between emotional and mental plane? Very interesting, Sonali. So we are talking here about phosphoric acid. And what means the emotional and mental plane? And what is phosphoric acid? Phosphoric acid, as you know, is a remedy we are using so often in the last 1 year. Almost many cases of post-COVID we are treating with phosphoric acid. So what the author here tries to tell you is a little bit about the mental and the emotional plane. What is a mental plane? It is related to the sensorium. It is related to the understanding. It is related to the will. It is related to the basic things that go on in your mind. So what happens in phosphoric acid is there is a mental plane dulled outness, which means they cannot understand things so easily. They slow down, their mind becomes blank. Mental exertion aggravates. There is a prostration of mind. They cannot do their work. They just give up. They want to chhodna. Phosphoric acid. What is the emotional plane? Emotional is where emotions come from. Means you are caring. Phosphoric acid is very caring, very affectionate. I want to give, I want to take care of you. I want to give so much for you. Unequal struggling against adverse circumstances. Phosphoric acid. At some point, this emotional plane dulls out, goes out. They become indifferent. They become apathetic. They say, "Arey jaane de, go for it. Hell, forget it. That's it. Arey chodo na baba. Arey baba. Arey baba ka." Phosphoric acid. So you see this two planes. I hope I was able to give you an idea. Phosphoric acid. Okay, Dr. Srishti, how about taking 3 or 4 most important questions which you feel I could answer?
Yes, sir. So one question that has been asked frequently is why 30C potency was selected as physical and mental symptoms were present, and why LM potency was not used in this case?
Uh, in this particular case, I have used 30 potency because I mainly prescribe there on the main symptoms at a physical level. See, a lot of mind symptoms of murex are not known. So you're prescribing at a physical level. So generally, I like to start with a little bit more lower potency. And that's why 30 potency. LM potency is another possibility that we can think about in this case. So if 30 works well, then later on I can go to LM.
A question by Dr. Madhu. Sir, she asked, can oleum be used in type 1 diabetes to activate the beta cells of pancreas?
I don't know. I don't know. I haven't used it, to be honest with you. So I really cannot tell you. But I don't do all these are theories. You know what Master Hahnemann spoke, right? He spoke, there is no place for theoretic medicine. Can this be used to activate that? I don't know. Yes, oleum jack will help the patient if the patient is oleum jack. Totality of symptom indicate the remedy. I hope you got the answer.
Dr. Mayuri Patil asked, will coffee antidotes the homeopathic medicine, and what are the other antidotes that we need to restrict patient in diet?
Not necessarily. There have been a significant research also done that not necessarily that people who drink coffee cannot take homeopathy. There's a very beautiful article. Maybe Srishti, you can find this out by Dr. P. Sankaran. Very beautiful article in the book Elements of Homeopathy, where he writes about how he did a research on people who were having coffee with homeopathy and they had good results as well. So not necessarily, but generally, if you see that you are oversensitive to coffee, it is better to reduce it. I personally was a very big coffee drinker, and I used to drink many coffees a day. I used to write many books, and then I reduced it. It helped me. So I think that generally, it's good idea to be not so addictive towards stimulants.
Dr. Yasmina asked, are all C remedies aggravated by milk?
Not necessarily. Not necessarily. I wouldn't call it as the main thing. A lot of C remedies have a good action on the hormones, and that's why there are many menstrual and thyroid related symptoms. It also has to do with a lot of iodine and salt, natrium mu in content. And there are a few common symptoms I feel of C remedies like better by motion, um, like sensitivity to music, like allergies, like hormonal disorders. There is some connection here.
Dr. Astha Agrawal asks, sir, can we use Murex in male patients?
Absolutely, when indicated. There are many cases of murex which are cured in men. One case of diabetes in a man was cured by murex. Main symptom was sinking in the abdomen, better by eating. Read Clark. सृष्टि पुट दैट केस, वो म्यूरेक्स का एक केस है क्लार्क में, आप पढ़ के डालो व्हाट्सएप ग्रुप में, अच्छा केस है.
So Dr. Corin asks, what about few indications that you can give for Asterias rubens?
Asteria rubens, I'll have to teach you that remedy. It's a long remedy. But generally, one of the main symptoms of Asteria rubens, it's a very historical remedy. It's a very well-known remedy for breast cancer. Contradiction aggravates a very important symptom of Asteria rubens. Anger on contradiction. There's a rubric, convulsions on contradiction in Asteria rubens. And very emotional, weeping ameliorates, like pulsatilla. And beautiful remedy for breast ulcers, breast cancers, especially tumors of the axillary gland. It's a beautiful remedy.